Hi again. So I'm Jodie Ann Senior. I'm a heart failure specialist, and I'm here to help educate you on how to empower yourself to get your best life, to have the best quality of life and the longest life that you can possibly have while living with your heart failure. We've talked about a lot of different things, medications and fluid balance, but you may not still quite understand what fluid balance is and how to actually achieve it. And this really is one of the most critical things that you can achieve for yourself. So if you do struggle from fluid retention, which could be seen as breathlessness, fluid collecting in your legs, in your feet, in your ankles, maybe you see it elsewhere, tummy, maybe in your hands, you can't explain weight gain that's happened suddenly, that sort of thing. So what should your proper weight be? Well, try and think back to a time, hopefully in recent memory, where you actually felt very well and you weren't experiencing any of those things. And that would be probably your what we call dry weight or euvolemic weight. That's the weight that you have when you have a normal amount of water retention in your body, not an excessive amount. And that's what you're going to have to go by. So, for example, that might be for you 65 and you might currently be 68. What that means in reality is that you're carrying 3 extra kilos of water. 1 kilogram equals 1 litre of water in weight. So you've got 3 litres of water. Imagine, a big jug with 3 litres of water, and that's sitting in your lungs or in your lungs and your body. And you want to get rid of that. How do you get rid of it? Well, you can't just suck it out with a syringe, although that'd be nice. You actually have to get it out by excreting it, by urinating. And your body is doing a certain amount of that on its own, but you might need help. You might need your doctor to prescribe you fluid tablets or diuretics. These are things like Lasix or frusemide. There are a bunch of others, but that's probably one of the most potent ones used. Now, the trick, however, is if you have been given or prescribed fluid tablets, is not to just take these and then continue to drink and eat whatever you normally do. The real goal is to actually get a negative fluid balance. By that we mean what's going out is more than what's going in. So you can track that. You can measure everything that's going in, and you could measure everything that's going out in a 24-hour period. That is, collect all your urine from the first wee of the morning till the next morning, and that will give you your output. And you can contrast that to your input, which you can calculate or measure. The easiest thing to do is to get a 1.5 litre bottle if you've been told to be on a 1.5 litre fluid restriction, and actually fill that bottle with water and then only drink from that bottle for the 24-hour period. And you can see as it's going down, it's an easy way to be able to gauge it. It's an easy way to keep track without lots of little errors in your guesstimates of what's actually going on, because at the end of the day, what's really going on is what happens with that weight shift. Because if your weight changes between one day and the next, then that has to actually be related to a fluid gain or a fluid loss, or even fluid balance, where what went in is exactly the same as what went out and your weight does not change. So how would we work this out? So I have an example. So let's say on day 0 your weight is 86 kilograms. And you can write this down if you want to, so you can track what the changes are and see them for yourself. Day 1, your weight is 86.1 kilograms. Now, in actual fact, what that means is your weight stayed pretty well the same. It went up 0.1. It's like 100 mils worth. Right, so let's say from day 1 you track your input and your output. So let's say you drink 1,550 mils in, and what you pass out you collect every time you go to the toilet, and what you measure is 2,100 mils of fluid out. That's an excess of urination over intake by 550 mils. And so by virtue of that, you should see your weight change downwards by around about 0.5 kilogram. Technically, if it follows exactly, it should be 0.55 kilograms down, but we got on this instance a weight difference of 0.51. So what happened there was day 2, the weight did exactly what we expected, and it dropped to 85.5 kilograms, so down that 0.51 kilograms. And that tracks with the difference between what went in and what went out. So you can keep doing that over the next days and see what's coming in versus what's coming out. And if there is a discrepancy, this thing is kind of like being on a diet. We all know that sometimes there are unintentional lapses in what you calculate. Sometimes those are intentional. But what does not lie is the weight. The weight gives us an objective idea of that fluid balance. So either you lost or you gained or you stayed the same. And in a 24-hour period, that has very little to do with what you ate. It's not entirely true, but it's mostly true for these types of examples. And we should get a pretty good idea then of what's actually happened. So if you lost weight, it means that more water went out than went in. If you gained weight, then more water went in than went out. So for example, if you come to me and you say, well, my weight went up 1 kilogram, but I stuck to my 1,500 mils, and I measured my urine output and it was 3 litres. Well, by that calculation, you had an excess output of 1,500 mils or 1.5 litres. Therefore, your weight must go down 1.5 kilograms. If you actually managed not even just to stay the same, but gain weight, then you not only drank in excess of that 1.5 litres to take you up to the same weight, but you actually had extra fluid to manage to gain, unless the reading is wrong for some other reason, which is unlikely, but again, occasionally it happens. Best way to work that out is measure again the next day and look for that trend. Look for what happened over the 2 days. Did you gain? Did you lose? Did you stay the same? So if you think you got one wrong measurement, sometimes we have to take that and say, all right, that doesn't make any sense. Genuinely look for the next day for the trend. But in my experience, mostly the weights actually tell you what's going on. There are occasions where for some reason that didn't quite work. But it's our best objective guide as to what's actually happening with fluid balance. So what your goal is then to achieve the dry weight or euvolemic weight that you estimate is the right weight for you. So if you know 6 months ago, before you had these problems, your weight was 70 kilograms, now it's 75, you've got 5 kilograms to lose in water weight, so 5 litres of water to lose. That's probably going to take you maybe a week to 10 days, depending on how fast you're losing it. And you should obviously be doing that with the guidance of your doctors. Some people need their kidneys or electrolytes watched fairly carefully when they're losing that much fluid. But achieving that weight and then working out, how do I maintain that? How do I stay exactly at that level? Because at that level where I don't have the excess fluid, that's when I'm going to feel the best. I'm not going to have the breathlessness. I'm not going to fear lying down at night because I'm too short of breath. I'm going to be able to walk without huffing and puffing so much. I'm going to be able to eat because I have more room and a bit of an appetite. So all these things that are really important. Your organs are going to function much better when they don't have all that waterlogging going on. So So you're going to achieve that weight, probably with the help of your doctor, and then you're going to learn to keep it at that weight. And keeping it there is as simple as whatever goes in has to be the same as what goes out. If what comes out is not enough, then more diuretics, or you reduce what's going in. It's that simple, that equation. What comes in, what comes out. To keep it even, if you're gaining, then something has to go and change. Either your input comes less or your output gets more. Output gets more is with diuretics, increasing the urine output. Input is simply you not drinking as much. So it's working out where the problem is. If you are genuinely fluid restricted, and that can be pretty difficult, I'm not going to lie, that's pretty tough, especially if you're feeling dry and thirsty all the time. But believe me, this is the way forward. You will adjust to the amount that you drink, and trust me, you can drink and drink and drink, and you will never get rid of that dryness in your mouth. It will happen so temporarily, and then you'll be back for more water. So you can drink as much as you like and be fluid loaded and miserable and sick and in hospital and recurrently in hospital until you die, or you get control of the fluid intake. You learn to deal with the dryness in any way you can, and there are multiple tips which I can give you in another section that will help you manage that dryness. But getting your head around it, getting used to it, as most patients will. Trust me, most patients will actually learn to do this really well. A few just can't seem to get it, or just perhaps don't have it in them. I won't judge that in any way, because I know it's really tough, but for whatever reason they just don't have it in them to be able to achieve it. But most people can. So I really would urge you to do that, because that's the one thing you can do that will make a huge difference to how heart failure goes for you. Massive difference. And it's the thing that you have the control over. I can advise you what to do, your doctors can advise you what to do, but if you can't do it, then we can't help you. So please get as much support as you can to do this one thing, and I know it's going to make all the difference. This is the thing that turns everything around for patients who are suffering from fluid overload. So please get a hold of that. So, look, no matter what you think happens, the weight tells us the story. That gives us our objective data, and achieving the correct weight is going to put you straight on a path to a much, much, much better future. What you don't measure, you cannot manage. So please, if you're stuck with this, measure, 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 measure. Every morning you should be getting up, you should be standing on the scales, weighing yourself and writing that weight down, and that's a weight that you take every time to your doctor, to your GP, to your heart specialist, to your heart failure specialist. This is what they're going to use to help work out where you are in your fluid status, as well as a clinical examination and a history. But that weight in the morning is the most critical thing. So if you aren't weighing yourself, please weigh yourself every day. If you aren't actually tracking what you drink, or have it so routine that it doesn't alter and you know exactly what it is, then please measure it. You don't measure it, you can't change it. And we can't work out what's going on. So weight every morning, fluid in. Maybe if things aren't working right, you need to measure fluid out, which is meaning collecting your urine for 24 hours to see what is going in versus what is going out, and whether or not those things add up and correlate with the weight. So we want this every day. One of the easiest things to do to track that is tabulate it, and I have Excel spreadsheets and other more fancy things, but you don't need fancy things. You can write it down on a piece of paper. It's really not that difficult. And Oh, when you weigh yourself first thing in the morning on an empty stomach before you've drunk anything, after you've emptied your bladder in the toilet. That is going to give you your proper weight each morning. So that's how I would instruct my patients to do it. And if you're still feeling like, you're not quite getting it, then, get some support from your doctor. Do you have a heart failure clinic or a heart failure coordinator or a nurse, someone that can help you with working these things out? If you're a bit stuck, ask for family support. Get them to watch this video. They might be able to figure it out and help you if you're not quite following what I'm asking of you. But hopefully it's not difficult. It's not that difficult. Not that difficult to understand. Might be a little more challenging to do because of the dryness of the mouth. I get that, but it isn't rocket science. It isn't spectacularly hard to understand, hopefully. And so, this is a good path forward to get control of that fluid balance, which is key in heart failure management. One of the most key things next to medications. So don't put that off. Get onto it. And if you have anything that you wish to share, please share, because I think other patients value any tips that you have that helped you in your journey that they might be able to use. And I'm certainly always willing to hear tips from my patients in terms of how makes it easier for them to do it. So please share, and I will come back in the next video and give you a few of mine. Okay? See you then.